However, we would be even happier if residents would do all they can do to take care of themselves, of their personal health and safety, so that they will not need to visit the facilities very often, because the best health center is the health center that don't need to be used.
If you look at the facility behind me that we will be opening shortly, you can see that the residents of Flanker will receive state-of-the-art health care, not only by the facility that they will be in, but by the continued workers of the Ministry of Health and Wellness. And so it is for that reason that we come here today under the auspices of the Poverty Reduction Program, a program that has been established in JSIF more than 20 years, a program that has been funded from its inception by the European Union and backstopped by the Planning Institute of Jamaica as a national authorizing agency. And so today we have, as a part of a bigger project, the Flankers Health Center, where we demolished the existing concrete structure. We've added 2 new consultation rooms, 2 treatment rooms, a health inspector's office, administration offices for the nurses, and of course perimeter fencing. And this has come at a cost of approximately $47.3 million. And we take the opportunity to recognize the residents here this afternoon. More than 3,000 residents and 14 members of staff will benefit from this new facility.
The EU remains Jamaica's largest provider of grant resources and continues to be deeply committed to supporting the attainment of Jamaica's national development goals. This commitment is evidenced by the current GOJ-EU cooperation program, which is aligned to the country's priorities. And these priorities are articulated in the successive medium-term socio-economic policy frameworks, or we call our MTFs, utilized to implement the National Development Plan Vision 2030 Jamaica. I wish to express my own gratitude to the EU on behalf of the people of Jamaica for their support and commitment over the past 46 years. The Flanker Health Center is one of 4 community health centers in St. James, which has benefited from a comprehensive expansion program under the PRP. The total cost of this health center is approximately $52,584,000, which will benefit an estimated 3,000 community members. The value of the health center goes beyond a monetary investment. The benefit to each community member must be seen as follows. 1, the health center will focus on people's well-being in and around Flanker and will enable individuals and families to attain a high level of holistic health. It will provide and promote healthy lifestyle choices through education, public awareness campaigns, and community outreach activities. 2, the health center will offer essential primary and preventive care services, which include basic doctor's visits, immunizations, health screenings, dental and health services. And this will aid in reducing the patient load and waiting time at major hospitals. And 3, through the provision of preventive care and assistance to patients to monitor chronic conditions, it will reduce medical costs as well as expensive emergency visits and hospital stays.
It is therefore a delight for me to join you today for the handing over ceremony for the Flanker Health Center. I understand that in addition to Flanker, this center also serves the neighboring communities of Norwood, Ironshore, White House, Providence Heights, and Seaview, a population of over 22,000 residents, with 2 additional consultation rooms, 2 additional treatment rooms, 2 additional nurses administration offices, 1 additional medical storage room, 1 health inspector administration office, 3 additional restrooms, and improved security due to the perimeter fencing. We can all be pleased that the staff at the Flanker Health Center will be able to provide improved health care for residents. We at the European Union are happy for the collaboration with residents, with the Ministry of Health, and with the Jamaica Social Investment Fund that has made today possible this. However, we would be even happier if residents would do all they can do to take care of themselves, of their personal health and safety, so that they will not need to visit the facilities very often, because the best health center is the health center that don't need to be used.
Health service, public health have to play a critical role in transforming our communities. We appreciate the work of the support of the European Union. We have one program we're working with you now, and we know there are others. But I just want to assure you that it's the direction of the government. Sometimes even our partners misunderstand. Projects operated in silos don't give you the results you want. Ministries operating in silos don't. So in fact, if I put on the other cap, as I said, man, that I chair what is called the Citizens Business Council, which is a committee of all permanent secretaries, the heads of the critical agencies, including JSF, the Planning Institute, and Hope Heart Dynasty, to ensure that the government's investment is coordinated and we can guarantee the highest value for every dollar we spend, whether on a building or on the people, and that the right people get the benefit from it.
Today, I really, and as always, celebrate when we improve our infrastructure and we make it comfortable for those persons who are critical to the entire community development process. And I describe primary health care, as I say, the nurse, the doctor, the center of the universe of community development and community buildup. And Minister Chang has a cliche, if you will, or a theme that he uses in security. I don't know if you know it. What is the police, the security? A force for good, right? Is that what it says? Well, I'm here to tell you that our public health infrastructure at the primary level is a force for good. And we have to keep preserving it and coordinating it. So I say that to say that Minister Chang, MP Chang and I are aligned, and the government of the day is aligned with the need to recognize, celebrate, and promote causes of this kind. And we pay tribute to the staff and the workers who are here every day and who will be here when we are gone. And we say to the community, work with them, preserve the infrastructure, and see them as partners in your own personal development, because that's what they are. And I want to say to the EU and to JSF and to the PIOJ, as we plan, particularly in a post-COVID era, we should always be looking for the gaps and filling those gaps and continue to recognize the importance of our healthcare system and the primary healthcare process. Congrats to the team here on the ground, and congrats to those who will benefit, particularly the community folk. Thank you very much. God bless.